So Pedicularis is one of my favorite herbs now. I've used the Bracteosa species. Whoops, I misspelled it, I see on the slide, so it's Bracte. I have also talked to people who have used Pedicularis racemosa, and Michael Moore in his Pacific West book recommends several other species as well, and I have no reason to think that wouldn't be fine. But this species tastes really nice, which is a little bit of a benefit over the kava, which most people tend to dislike the taste of. But it works very similar to the Lita kava. We do use the flowering tops. It's fairly widespread, although it's not totally clear to me how common this is. So if you were harvesting this, you'd want to make sure you were in an area with quite a few plants and you were just taking a few. And make sure that, if you take an entire stand, it's going to be a lot harder for it to spread and maintain itself. Anyhow, I've used the fresh plant tincture. The tea is actually somewhat more diuretic, so although I think it's delicious, it's a wonderful beverage tea, calming, really nice when you're out camping and hiking in the Cascades anyway. I would be careful about giving it as a tea to someone with one of these syndromes. But the tincture doesn't seem to have that problem. So dose-wise, a minimum of 1 milliliter 3 times a day, and you probably more than that if you're using it as a simple, but in a formula, minimum about of 1 ml. And if they're in really acute situation, you could easily dose it more frequently. So at 4, 5, or even 6 times a day for a few days would be totally safe and fine. The one safety concern about this plant is that it is a hemiparasitic species, so it's photosynthetic, but it also parasitizes other plants. So if it happens to be parasitizing a toxic plant, it could become toxic. So this slide I like because it's growing where you'd want to harvest it, in a field of grass. If it's parasitizing anything, it's grass here, and that's very unlikely to lead to a toxic situation. But at least in our region, I frequently see it growing next to lupin and next to veratrum. Well, I've been thrilled with it. I've really loved it. It's one of the herbs where, some herbs are so gentle, you're just like, is this really working? What's this doing? This one, there's no doubt. It's very dramatic. And I have a couple prostatitis-related stories that confirm that. So one of them was, actually both of these patients were having clearly sort of a urological or kind of crossover inflammatory kind of phenotype. I had them on formulas with kava in them. They were helping. They definitely felt a lot better. And we were doing food and gut-related work. But then I found out about Pedicularis. I mean, I had read about it, but I'd never really tried it. But I was on a field trip in the Cascades. I said, you know what, I'm just going to harvest this stuff, and I'm going to try it. So I picked it myself, I tinctured it, and I asked these two gentlemen if they would be okay if I added it to their formulas. I had talked to Howie, and he said it's fine and safe, and I had harvested it away from anything toxic. So I switched it for both of them for kava, and they both told me it was not just a little bit better, it was significantly better. They were really pleased that I had changed it, and please don't change it back. Now, of course, that made, they knew it wasn't sort of placebo, but since then I've been adding it, just as a matter of course, and really liking the effects. So it does seem to decrease pain and anxiety. So we're going to hear this one again for the psychosocial phenotype. But just, really, I really love this herb. Wonderful medicine.